For me, good nursing care is to be critical to the routines. And normally when nurses, it could also be midwives and physiotherapists and others, they are doing their job. They are using knowledge from training and experience. And that's also important empirical knowledge, but that's not enough if we want to improve better clinical practice today and also in the future. And therefore it's very important that nurses and so on, they always reflect on their daily practice. They are asking questions, they are wondering why are we doing as we are, and maybe also ask for answers to those questions. At Aalborg University Hospital we have organized research in clinical nursing at Clinical Nursing Research Unit. Just at the moment we are 6 nurses educated at a PhD level, and we have connected 14 PhD students. And it's possible for us to work together with all the units at Aalborg University Hospital. We expect to initiate about 40 research projects until 2018. Laura, she is a good example of a midwife who contacted us to get some help to start a research project.
The aim of the research project is to study women's experiences with labor pain in relation to induced labor, and then compare it to women who are giving birth with a spontaneous onset of labor. The project consists of 2 parts. One quantitative part focusing on the women's pain, and secondly qualitative part focusing on the laboring women's self-image and how induced labor affects that. My research project has grown out of a concrete, very simple wondering in everyday practice. At the hospital, 25% of all deliveries are induced. And we have very, very little knowledge about what these women experiences and also how it affects their pain during these deliveries. No prior studies uncover this subject sufficiently. So I decided to do this research project because this knowledge is needed, and because I think that involvement of the patients is very important, and also because I think research in the midwifery field is extremely important to create an obstetric care which represents all nuances. The research unit provides me with skilled and appropriate supervisors, and that ensures me a certain academic level for the results to be taken seriously. Furthermore, the cooperation with the research unit gives me access to different services, for instance fundraising, statistics and library services. And basically the cooperation makes everything run quite smoothly, and it feels like it's not a struggle during this project. Things are really, really going well because of that.